Hi, Miss Elvera. It's nice meeting you. Please take a seat. And by the way, I am Leland Bulwan and I will be your clinical psychologist. And thank you for coming here today. Before we begin, I'd like to explain that this interview will meant to understand your concern and also to formulate a treatment plan. And also, by the way, this discussion, we might talk about your experiences, your symptoms, and of course, your history so that we can provide a better treatment plan for your concern. And I'd also like you to know that everything we share here is confidential, meaning it stays between us. However, there are also some exemptions, especially if I believe that you're at risk of harming yourself and others, or if there's any concern about abuse or neglect. So I may be required to report it to the appropriate authorities. Do you have any questions about confidentiality? No. Okay, so if everything is clear, I'll ask you to sign this informed consent, which outlines what I have discussed earlier. So just take your time to read information in the informed consent. Thank you. So, this session will last about 50 minutes. So, we'll start by discussing your main concerns, explore your history, and assess how your symptoms impact your daily life. So, toward the end, we'll talk about possible treatment options and your goal for therapy. And feel free to take your time in responding, and if you feel uncomfortable, please let me know. Okay? So, shall we get started?
Yes,
So, what brings you here today, by the way?
and I was diagnosed with trichotillomania, this hair pulling disorder. And I feel overwhelmed to pull my hair sa akong scalp. Actually, visible na ang kuan ka ng bald part sa akong scalp. And i-try ko na ko siya resist by putting band-aids sa akong finger. Pero wala lagi hapon. Naka-affect yung siya sa akong kuan, sa akong confidence and my self-esteem, especially sa akong work nga secretary ko, and I have to go with my boss sa mga meeting, if may social gatherings, and ma-feel na ko nga, I feel like I'm being judged or what, kay agi sa ang baldness sa akong kuan sa, and I even have to wear wigs and hats para ma-cover ang kuan baldness.
Yes, I understand. So now let's explore your symptoms in more details. Okay? So, do you feel any urge or tension before pulling your hair?
Yes, I feel a growing tension and anxiety before pulling my hair.
Sa imong gibuhat, naka-feel kang pleasure or relief?
Yeah, but ang pleasure and ang relief na mga-feel is temporary lang bitaw, kay after that kay naka-feel na dahil ko guilt kay nag-pull na po ko hair.
So, nabay certain situation or stressor nga naka-trigger sa imong behavior?
Yeah, especially pag kuan, ma-stress ko or ma-anxious ko sa akong work.
So, imo ba siyang gitry stop? Then, unsa kay nito?
Yeah, di try na ko siya stop. I tried putting band-aid sa fingers na ko, pero wala na siya gihapon. Nagyapon ang kuan, mag-pull gyapon ko hair dayon. I have to use wigs or hats para makaveran ko nga bang.
So, sa imong gibuhat, naka-feel ka og guilt or shame?
Yeah, I feel kuan, embarrassed kay maapektuhan akong self-confidence kay visible na magud ang bald.
So, have you noticed any patterns or behavior related to hair pulling?
Yeah, it usually happens when I'm feeling anxious or overwhelmed with my work.
Okay. So, how has hair pulling affected your relationship and social life?
Kuan, I avoid kuan social situations, and I also feel like na-conscious ko pag nako sa public. Then sometimes kay I absent sa akong work kay kuan ka na ang pagkabalo ko nga nabitay mga gatherings ko absent ko kay ma-conscious ko pag naay na ng tao.
So, paano sa mga siya naka-apekto sa iyong work performance?
Mag-isa ko concentrate sa akong work dayon kuan ka na dagan akong absent.
So, do you avoid certain situations or clothing because of this?
Yeah, I even kuan magsuot ko wigs and hats para makabaran tong part sa akong scalp na bag.
So, can you tell me about your childhood and adolescence?
Well, I was born in Madrid, Spain, but I have Cebuano roots and I had a normal childhood, but I have always been an anxious person.
So, na may specific na time nga nag-start na siyang behavior or nagka-worse?
Yeah, I noticed it in my late teens, but just got worsened when I started working.
So, naka-observe ba ka nga na yung mga major changes or mga stressors by the time na nagsugod na siyang behavior?
Yeah, when I moved away from home and adjusted from my responsibilities.
So, after you have observed that one, do you seek to therapy or counseling?
Yeah, I have seen a psychologist before, but I didn't stay long enough kay I thought kuan lang siya normal response lang bitaw na ko hindi ma-feel ko stress or ma-anxious ko. But I feel like it's already serious na.
So, have you taken any medication related to mental concerns?
No, wala ra ko.
So, sa imong pamilya, napod ba nga similar conditions as yours?
I think wala ra ko.
So, sa imong gipuyan karon, kasi man kauban, ano ba kay kauban?
I live alone.
Ah, so since you're living alone, naka-feel ka ba ka nga imong friends and family kay supported gyapon or nakasupport pa gyapon sa imo regarding your condition?
Well, my friends doesn't know about it because I don't talk about it much with them, but my family knows about it, but I feel like they don't understand it that much.
So although na sila, kabul sila sa imong condition, pero dili jud deep lang knowledge about sa kung saan na siya ka-works, yan ano. So about po sa imong work, kung sa jud imong role sa office?
Well, I work as a corporate secretary and it's part of my job po na ma-attend ko sa mga meetings sa akong boss and ma-attend ko kung social gatherings sa company.
So kung nakay mga free time, sa mga kain mong ginabuhat?
I usually read and watch movies, but I usually isolate myself.
So regarding po sa imong mga past experiences, may mga stressors, mga traumatic events na pwede magkakos ano yung behavior?
I have experienced pressure and stress, but traumatic events I think wala ako.
So now let's have a quick assessment for your mental state. So how do you feel today, by the way?
I feel anxious but hopeful.
So what are your thoughts about your current life situation?
I actually feel frustrated with my inability to control my hair pulling.
So have you noticed an increasing manifestation in anxiety, stress, or depression recently?
Yes, in my work stress.
So, when it comes to your cognitive processes, do they feel like repetitive or distressing?
Yes, I experience repetitive thoughts about my hair and my appearance.
So, have you ever felt hopeless or had a thought of harming yourself?
No.
So, at this moment, let us now formulate a treatment plan and what to do next. So, what do you hope to accomplish
reduce my hair pulling, and I also want to regain back my confidence in social settings.
So, unsa man jud na certain thing, certain behavior na gusto mo ma-change after the therapy session?
Controlling my urges and reducing my anxiety.
Mm. So, naka-try na ba kang mga strategies sa past mo na you think helpful na po siya?
Yes, I tried using hats and making my hands busy, but they are not that effective, June.
Okay, so based on what we have discussed, I recommend a CBT or cognitive behavioral therapy and habit reversal training. Meaning, mag-focus ka on identifying and addressing the thoughts, feelings, and situations that triggers the behavior. So, magamit ta og habit reversal training para ma-identify na to itong mga triggers and also para ma-replace na to itong hair pulling to alternative coping mechanisms. So, okay na ba na siyang approach or willing na ba kang matry, Anna?
Yes, I think it's helpful.
Okay, so I'd like to schedule for a next session. Sa nga time or day nga okay sa imo nga or convenient para sa imo?
I think on Saturdays.
Saturdays. I think it will also do for me. So I think we need to meet at least once a week. Is it okay with you?
Yes, that's fine.
Okay, so I guess mag-stick na tayo ng schedule no once a week every Saturday. So thank you for sharing so much with me today. I know it's not always easy to share those experiences, but you have taken an important step toward improving yourself. So we have identified that stress at work is a significant trigger, and you have also tried various coping strategies like wearing hats and wigs, but you found it ineffective. So our treatment plan will focus on CBT or cognitive behavioral therapy and habit reversal training. So meaning we will focus on identifying those triggers and developing alternative mechanisms, and of course your goal to reduce hair pulling behavior and regain confidence in social setting. So I appreciate your time, Elvira. I look forward to working with you. Take care and I'll see you to our next session.
Thank you din po.